Good evening, everyone, and welcome back to another episode of CarnivorousGrama Speaks. This is the place where faith meets fierce transformation. I'm your host, Robin Heron. I'm a wife, a mom, and a grandmother of 11. And I am also a woman on a mission to help you heal your body, renew your mind, and walk boldly in the purpose that God designed for you. I'm super excited to be here tonight with my friends Laura and DeNitra. I'm going to have them go ahead and introduce themselves. Hey, Laura.
Hey, so I'm a registered nurse. I've been a nurse for over 22 years. I started keto in 1991, not knowing what I was doing, and then transitioned over to carnivore in 2019. So I do work with a lot of clients, and of course, all of my home health patients get free health advice every day. So that is kind of just me in a nutshell.
Thank you, Laura. We also have our ace here, DeNitra Davis. And so, DeNitra, would you mind going ahead and introducing yourself?
Absolutely. So I am DeNitra Davis. I am an educator. I am certified to teach, taught in Tennessee for many years. I will say, Laura, that there was a time in my life where I was going to be a nurse. In high school, I studied nursing and the math became a bit much for me. So
It's a
I've been
lot.
a teacher. And so in the last 3 years, I've been a metabolic health practitioner. And I have been practicing carnivore-ish. I'll tell y'all about that for the last 3 years.
Awesome. Welcome to both of you. So tonight I'm super excited to bring you this topic. So I have been carnivore for 787 days. That is 2 years and 2 months. And I had my labs drawn last summer at my birthday, which was July 22nd. And Laura and I came in here to review them together. And so today, I just recently had my labs done again, and I thought it would be really, really cool to get a perspective between a nurse as well as a metabolic health practitioner, DeNitra. So I'm very excited to bring you guys this tonight. I'm going to be completely open with y'all and raw because y'all are going to get to see what my lab said. You're going to get to see what my lab said. So if you're interested in hearing about somebody who's been on carnivore for what I would call long term, but not very, very long term. So over 2 years, what's happening with what's going on with me and my labs. Go ahead and share this video out. I also would appreciate it if you would go ahead and click that like button. And then, of course, you can subscribe to my channel. So I'm super excited to be here. For me, I have been carnivore for 2 years. And I have found as I've gone along that I have so many food sensitivities that I did not realize that I had. So this is the biggest thing that's changing for me is that when I think about the things that I can tolerate on my carnivore way of eating, it's becoming very narrow and really is focused on meat. The most recent one has been cheese. I've had to give it up. And it's been very, very difficult. It's been very emotional for me to have to give that up. But I literally, my hands will just boil, blisters will just pop up all in my hands. Yesterday I went out to dinner. I had some kind of spice blend or something. It caused my hands to flare up. So I'm becoming more and more restrictive. So while I know that carnivore is not necessary for every single person, I'm finding out that it truly is the right diet for me. It's the right way of eating for me. And so I'm really figuring that out as I go along. And I do a lot of experimentation. So physically, I've lost about 25 pounds so far. I'm very close to my goal weight. I think I'm within 10 pounds of what I would call my goal weight. And so we'll see, as we go along where the carnivore diet lands me as far as weight is concerned. My body composition, everything's redistributing. Like I'm seeing a lot of changes in the way my body is shaped. And the main thing that I'm doing is walking because DeNitra brought us this walking challenge, which is 14,000 steps a day. And so that is the main movement that I'm getting, but my body shape is redistributing. And one of the things about the spiritual aspect of it for me, as you know, if you guys watch my channel, you know that I'm a church girl, but the spiritual thing about it for me is around what I believe that the Lord is doing with food in this moment for us, and how he's bringing the things back to us, what we should be doing to, and how we've been damaging our bodies. So those are some things that have been, for me, the mindset change, the way I think about eating, trying to eat. We heard this from DeNitra's doctor. She was on Hey Sister Girl a couple of weeks ago, and she said, stop loving the foods that don't love you. What? Stop loving foods that don't love you. So why do I love cheese and cheese does not love me? Right? So that is the thing. That's what I'm doing. And today we're going to review these labs. I've got a slide deck and we're going to get started with Laura and she can run us through. So I'm going to present my screen, Laura. Okay. And you can get us going over here with this. So I did a side-by-side comparison between last summer and this year.
Yeah. So congratulations on that many days. That's amazing. And I do agree that not everybody, I work with a lot of clients that ketovore is perfect for them or keto. But just like you, as I found for myself, I had so many intolerances that it's just more enjoyable for me to stay carnivore with the occasional fermented pickle or fermented cabbage, a bite, not like, 2 or 3 of any of this stuff. So, yeah. So anyway, as a nurse, when I work with my clients, the things that I kind of watch for when it comes to their labs, you want to see changes for the good. And there are times that you'll have ebbs and flows. Like I've had some patients who's been on for 3 years and their hemoglobin A1C goes up. And they're like, wait a minute, I'm not eating any carbohydrates. And I'm like, that's gluconeogenesis. So they get like a glycated albumin, which, is another marker that you can do. So there are some things I like trends. So I like seeing the graphs. I like kind of see where everything's going. As for like red flags, on yours, I see no red flags, but I've had those where I'm like, we need to tweak something. They need to get, and sometimes it's changing up what they're eating. Sometimes it may be a supplement that they need to take to help with something. So that's kind of what I, as a nurse, look for with things like that. So with yours, like your red blood cells, I mean, you stay really in a good range. Everything seemed to be pretty stable there. Same with your MCV and your MCH, you had a little change in those. Just those are just an average of the size of your red blood cells for the most part. So that looked very well. Your A1C improved a tenth, which is still an improvement. And then your liver, of course, that's an improvement. So everything liver related looked great.
I'm going to go down to
Let's
that
see.
really quick, Laura. Let's see if
Sure.
I can get this
Sure.
thing to move. Okay.
Yep. So like your AST and your ALT.
Where is that? Here, right here. Okay, liver function.
Yep. Yep. Yeah. So like the AST is aspartate aminotransferase, is just a fancy thing. It determines kind of like how your liver is functioning. If you have too much of this, it can be a problem. You see it a lot with people with fatty liver disease, non-alcoholic, fatty liver disease, cirrhosis, things like that. But yours is improved. Also the ALT, which is it's an enzyme that can be indicative of a problem. And it kind of shows how you convert, how well you're converting your proteins into energy. So, and that's very well as well. So I think, if I was looking at this on a fast horse, that I'd be like, hey, those are improvements. I see good things. And I don't know, were you ever diagnosed with fatty liver disease or no?
So, the funny thing is a few years back, I mean, several years back, I was having a lot of liver issues, and I
Mm.
can't remember what I was being diagnosed with, but I remember having to have these, biopsies and go under I don't
Wow.
know, into the whatever machine they send you through to take a look at it, and so
Yeah.
there was a lot of things that were going on with my liver several years back. But then all of a sudden there was nothing. I mean, they just stopped talking about it. So I'm not sure.
Hmm.
I'm not sure if it was, fatty liver. Likely it was, because I was eating a standard
Yeah.
American diet.
Sure. Sure. Yeah. Yeah. And then my favorite, um, I love cholesterol because I knew 20 or no, I knew 33 years ago that the cholesterol was a myth as to how they were portraying it out in the medical establishments. Um, so your cholesterol went from 208 to 230, which I say kudos. I think that's great. Your HDL that went from 78 to 82, so that came up, which is good. And your LDL went from 117 to 137. And I'm always happy when somebody's LDL has come up. Of course, some people go ahead and get like particle size and apolipoprotein, testing to see exactly what type of cells they have running around and the size of them, of those LDL particle size. Um, but that's how our body, takes in vitamin D, how we can actually use it. We need that cholesterol, you need that LDL for your immune system to do its thing to kind of get where it needs to be dropped off and um, kind of like your little helper cells. So I thought that was really, really good. Now the next one was the TSH that I kind of was like, oh, there's definitely a pretty significant change there, where your TSH was 2.53 and now is 1.76. Um, so, had you ever been talked to about getting close to like hypothyroidism or no? No.
No,
Okay.
never.
I mean,
Mm-mm.
yeah, I mean, you were definitely, and I don't know what you might have been like 5 years before that, but like if I was looking at that, depending where you came from, I'd be like, you're trending, to that. Um,
Okay.
yeah.
So
So,
one of the things that
and
I am doing, Laura, is I do take
mm,
iodine,
yes.
pretty much every
Yeah.
day.
Yeah. Me too.
So
Yeah.
that is a little surprising, but yes, I do take iodine,
Yeah.
every single day, at this point.
Yeah. But yeah. Yeah. And I think that probably is part of that. I think that's helpful. I think that's very similar. I think mine's like 1.67 or something. So, my doctor that I work with, it's holistic functional. She's very happy with where mine sits now that I've been doing the iodine. Mine was like 2.9 before, and she was
Mhm.
like, that's getting a little, worrisome for her.
Mm.
So, yep.
So
So she
going
and
down is good then, not bad.
mhm. Yeah, I mean, that's how I've been trained to look at it. Um, And then a lot of people, when they look at a TSH, if it's like out of range, um, is they tend to always be like, oh, my thyroid's bad. And I'm like, well, that kind of depends because really the pituitary is what produces the TSH and sends it down for the thyroid to convert. So that's not always something like that. It's rare that you have something pituitary, but I have had somebody who had a pituitary gland tumor that was
Mm.
non-cancerous that threw their numbers off, but it's rare. So um, another thing was the next ones are what we look at with kidneys, and so you stayed really pretty stable there with your BUN creatinine,
Okay, I
just
didn't
showing
put
how
those
you
in here.
clear.
Yeah.
That's okay. Which it just kind of shows. how you clear stuff. Your GFR is good. It's also an
Oh, here it
improvement.
is, right here.
So,
Yeah, metabolic
okay, yeah.
panel.
So, yep, it's in the CMP. Yeah.
Mhm.
So, with this test, I have seen with a lot of the clients that I work with where BUN, creatinine, and GFR go up when they are carnivore. And I've listened to like Dr. Berry, Dr. Chafee, and Baker talk about that. And the way they explain it is when you're eating like 80% of your food is protein, you're going to have more of those breakdown products. It's whether you're clearing those out. Um, and you are. So, I think that's kudos to you, and your little kidneys are doing good, which I think if I remember right, I think you said you do have some family history of some kidney issues.
Yeah, I do.
Right. Yeah. So, and then another one was your just surprised me that your B12 actually went down. And I mean, it's
Mm.
still like I'm not afraid of B12 being like much higher than that. Uh, but I just thought, well, that's weird. I mean, I know you're eating all the meats, but your B12 is down a little bit, but it's still within perfect range. I
Mm.
One thing I would do is I would definitely just have them check a vitamin D level, and the next time you get
Yeah.
that. And also, I didn't see a reverse T3, which is
No,
something
I
that,
didn't see any of those,
yeah, they did the
those are
TSH,
thyroid,
which
right?
is,
I didn't see those in
yeah,
there.
yeah. And I thought that was odd. I thought, yeah, usually, um, and I think I'm just spoiled because my gal, she is really, really good. And she does everything that she's had me run. I've just been like, huh. Then I'll hear some of the doctors talk about it, and I was like, she's really good. And she's very nice. She's very, very nice lady. So,
Yeah.
my biggest takeaway was that your insulin sensitivity when I saw that. Um, that is anything they say anything under 10. That's what the average is, what they tell people. I really tell my people that if you can get to 5 and under, it's a good measurement. So that's kind of what I when I looked at this is something I was like, this is kind of like DeNitra had said, this is something that, you really want to strive for. I mean, you always want your other lab markers to be somewhat okay, but we have to remember that most of the lab values, whether it be high or low, are set up on the average person out there, and we're not eating average. And so, hopefully, I think Dr. Berry has talked about coming up with some lab values that are a little bit more reflective of the ketogenic, ketovore, and carnivore. So, if he does that, I'll buy that book too because I have the Common
Right.
Sense Labs as well.
Yeah, that's the
um,
one I need to get because I feel like I missed my opportunity to get some of those labs that Dr. Berry recommends that we could
yeah,
have looked at, but I'll make sure that next time I get that list correct.
yeah. Yeah, yeah, so that's something that you could do, and do you only get your labs done from your doctor's orders, or have you ever went out and used own your own labs?
I have not done own your own labs,
Okay,
as of yet, but that's not to say that I
okay,
wouldn't do that. I've been getting them done, once a year. So, I know,
yeah,
and DeNitra will probably say this, that she recommends getting
mhm,
them more often than that. So I'll end up
yes,
doing something like an own your own labs to do that.
yeah. Yeah. The one thing I will say about own your own labs, I've had great ability of getting the lab work that you want. Of course, you just have to make sure that the lab that you have, LabCorp in your area, we have 4 in my area, and only 2 will take those orders because they don't come with a diagnosis code.
Mm,
At least they didn't the last time I did them, and so some of those labs, if they're kind of connected to a hospital system or a clinic, then that's the ones that wouldn't take it. It was the standalones that were out like in the community. They would take those because I started to purchase all the ones all the tests I wanted. And I was like, I'm going to call there first. It's kind of like that mom brain of check before you pay for something.
Right.
And yeah, the two that were the closest that would have been the ones I, normally would have went to, they said, no, they have to have a diagnosis code. And I said, even though insurance is not going to be paying for this, I'm paying for it. And they said, yeah, we can't run those. And I was like, okay. So I just
Wow.
always kind of tell people to just double check. So um, and the other difference is when looking at labs, we look at the difference between your functional ranges and your clinical ranges. And so with me, I and I think it's just because of dealing with my own doctor that I have that does do the more holistic functional. She, what she'll want my all my hormones, like whether it be my TSH, my T3, T4, reverse T3, T4, my estrogen, whatever it be. If you looked at it, you'd be like, oh, that's a little higher than what the normal shows on the routine, the clinical range. And then she is very much, and I hope everybody has the opportunity to try to find either their own physician that'll do this primary or somebody that can order these kinds of things and work with them that has an open mind to these things or is educated in this stuff as my doctor. I mean, she is heaven sent for sure. And we're very lucky to have her in such a small area. I mean,
Mhm.
my town today, we looked it up, has 119 people.
Wow.
My next town over, which where there's two metabolic, functional holistic docs, both of them, they're in a town that's 2,900. I mean, that's unheard of. So I feel very fortunate that I'm able to work with somebody, a naturopath like that. So that is kind of what my takeaway was. And I always also ask people, like, if they're having symptoms. I work with a gentleman who has fatty liver that it's almost completely reversed at this point. And same with kidneys. His doctor kept saying he's got protein urea, and he was freaking out. And I was like, well, let's see, how do you feel? And he didn't have any clinical signs of any of that. In fact, he had the opposite. He had lower blood pressure. He had better urine stream. I mean, he had all the things that go with it being
Wow.
good. And I
Mhm.
was like, you're only eating fat. You're not, and meat. You're not eating vegetables to have that breakdown, And I was like, I don't think it's abnormal unless you start having trouble. And then, you work with people and tell them kind of what their signs are to watch for. So that is how as a nurse that's been doing this, that's kind of how I look at it. And just because it has a flag when I see a patient's labs does not mean I'm going to run out there and lose my mind, because most of the time I'm like, no, that's probably where you want that, kind of like the cholesterol.
Right. Yeah.
Yeah.
Well, thank
Yeah.
you, Laura. I definitely
Yeah.
appreciate that. Appreciate your perspective on these labs. And so we're going to turn it over to DeNitra, and she's going to talk about her view of what she sees. Do you want me to bring the labs back up, DeNitra? You're on mute.
I do have a question about the fasting insulin on your document. I don't know that I saw the fasting insulin. I
Yes,
see.
it is. I'll share my screen right here.
Okay.
This is the metabolic panel, and I did not have fasting insulin drawn last year in
First
2024, but
time.
at the very bottom, you'll see my
I see it's
fasting
at the
insulin.
bottom though. Okay, okay,
Mhm.
okay. There wasn't a comparison.
4.3. Yeah.
Okay, okay. Yeah, so I've learned so much. I'm like blown away already with being here with Laura. So thank you. So
Mhm.
just a bit of background about my role as a metabolic health practitioner so that we can hear the differences. So first of all, I am not a doctor. I don't author medical advice. I don't diagnose. That is, I am educational in a sense, right? And so many things that you can learn from me, I am going to bring awareness to certain things educationally. So even I am not equipped to do all of what Laura just did. So that's the first thing. So like I'm blown away with listening. However, my certification and accreditation is through the Society of Metabolic Health Practitioners. And so essentially, I have the same training of doctors who are interested in treating their patients with a ketogenic or therapeutic carbohydrate restriction versus medicines. And so what I am often looking for when I am working with my clients is I review their labs. And so I'm mainly looking for a fasting insulin. I'm looking for the A1C and helping them understand what those two numbers mean. Those are the main ones. Of course, I work with them to help them understand what insulin resistance is. And so I'll just give a little snippet about what insulin resistance is. It means that your body is resisting the insulin that is in your body, period, right? And how does that happen? That happens when you overeat carbohydrates, basically. It is the fastest way to become insulin resistant is that you're overeating carbohydrates. And so then I take it a step further and say, what are carbohydrates? Carbohydrates are saccharides. They are sugar in any form, whether it is the sweet kind that we like to eat the taste, or whether it is the not so sweet kind like a beans or potatoes or salad. They are still going to be sugar in the body. So over consuming those things is what causes insulin a problem in the body. And so the goal is when we think about if we could get certain tests sooner, then we can reverse, decrease, or prevent some illnesses that we've dealt with. And so when we're looking at that in America, that 93% of Americans are metabolically unwell, that means that their metabolism isn't working, and it's not working based on what they, or we, because I'm one of them, have been eating. I am still insulin resistant. I am getting closer to being insulin sensitive. So tonight, I just wanted to lay those things as a foundation for people who are watching so that they can know basically the purpose. A lot of times we are looking at if I'm diabetic or I'm not diabetic. And a lot of times, even with doctors, God love them, even with doctors, a lot of the numbers that you are going to hear me talk about, those numbers are only used to determine if you're diabetic or pre-diabetic or not diabetic. And there's a huge loss when we're only focused on that, because you can be insulin resistant and never be diabetic, never be pre-diabetic. However, you still have some challenges with your health. And that is the thing that we want to start to uncover. And it's a missing opportunity if we don't see A1C especially as more than diabetic or not diabetic. So I just want to say that as a lead in. And so, Robin, if you want to pull your labs, many of the labs I'm not trained to discuss. What I would do in that case is pull Dr. Berry's book, come in those labs, and have a whole conversation related to them. So the two that I am going to focus on mainly is the A1C. And the A1C is a 5.7. That's what the slash means, Robin.
Yes, I'm sorry. Those are not supposed to be slashes. They're supposed to be points.
Okay. All right. So we see a 5.7 as the one in July 2024, and we see a 1/10 of a point decrease in the second one. Now, in a normal metabolic panel, a doctor would say that you went from being pre-diabetic with the 5.7 range to being a 1/10 of a point away from being pre-diabetic. However, for me, and my training says that the 5.6 still lives in the insulin resistant range. really to be out of the insulin resistant range, you want to be under a 5. And I capture these numbers from the Society of Metabolic Health. Anyone can go there and pull their document.
Mhm.
And before we hang up, Robin, I can share that if people are interested. And so you may ask, why is that important? It's important because oftentimes in the 5.7 range, people see pre-diabetes and they have a comfort level of saying that I'm pre-diabetic. I'm not diabetic yet. I got time. There's some safety zone here, right? And what I often say is don't let the pre fool you. The pre means that there has been at least 10 years of damage of high glucose ranges, right? And so because of that, you want to take that seriously. When I said earlier that 93% of Americans are metabolically unwell, we have to decide, which range am I in? Are you in the 7% of people who are metabolically well, or are you in the 93%? And these details from these type of labs will help you with that. So for a Robin who has become carnivore and is working diligently to improve health, this is miraculous, right? We are moving into the insulin sensitive range, right? But because Robin is highly aware, we really still want to see that A1C keep dropping, right? The beauty that we have here, and we don't have a before number for the fasting insulin, but her fasting insulin is a 4.3. And according to the Society of Metabolic Health, we want fasting insulin to be under 6. So we're doing miraculous with that. So let me just kind of unpack that a little bit. So typically what I see when I'm working with clients is I see them in the pre-diabetic range or that 10th of a point away from being pre-diabetic. But I also see along with that a fasting insulin of a 7 or 8. And so that's an immediate trigger for me to say there's some insulin resistance happening here, right? When that fasting insulin is up and the A1C is a 5.6, 5.7, right? That says insulin resistance is happening. What does that mean for a person? That means that you have been consistently running a high blood glucose, which means that what you want to start doing is what Robin is doing, is taking carbohydrates out of your diet so that you can bring that number down. Remember, carbohydrates are sugar. So it's making sugar. The body can only manage 1 teaspoon of sugar a day.
Yep.
So when you eat more than that 1 teaspoon, that means your blood glucose is running high. Is it registering on a A1C yet? Maybe not. Remember, it takes 10 years. I equate it to having a nail stuck in your tire, where you got the nail, 50 miles away. You were in a ball field where there was some construction going on and you rolled over, but you were able to make it all the way home on that nail. But when you woke up in the morning, your tire was on flat, right? It's essentially what's happening in the body. So this is not a time to get excited about being pre-diabetic. This is not a time to be excited about being in the 5.6 range and just, chill. And I would say that I blame doctors for this because they say, and I know this because it's been said to me, they say, just watch what you're eating. Well, every time I take a bite, I'm watching it. And what has that done for me?
Yeah.
I liked it. That's why when I saw that cake, I was watching it. That's why I picked it, right? So what is the watching doing for me? This is a time to become proactive. This is almost equivalent to, and my husband hates this analogy, but it's so powerful that I'm going to say it on your show, Robin.
All right.
It's almost like going to find out that you are HIV negative. And then you continue to have unprotected intercourse with people who are HIV. Eventually, you're
Yep.
going to get caught. It's the same thing. So if you get these kind of labs, this is what lab work is for. So no longer are we going to sit in a place of my doctor said all my numbers are good. Because technically, all the numbers are good, right? You in the green with your A1C, but it's almost equivalent to, as a teacher, that you were between a D and an F. You weren't between an A and an F. It's like, how close do you want to play it?
Right.
So for me on tonight, I think, Robin, you are moving in that insulin sensitive place, right? Your body is more insulin sensitive probably than it has been your entire life, but it is because you are being proactive about what you eat. You're serious about it. I think the other beauty to being able to review your labs, I feel privileged to be a part of this because it also speaks to people having a problem with carnivore. People have a problem with just eating animal-based. And what we're able to see right here is that you've been animal-based for 2 years. And we've talked on here about on our show about all the things that you have improved, right? And now we got labs to back up. Sister girl, you're moving in the right direction, right? And this is why we encourage people to try this protocol. It is not about being pre-diabetic or diabetic. It is about being insulin sensitive, right? And so, Robin, one of the things that I want to do, so those are my labs. That's what I'm qualified to review. If you had your blood pressure here, we could look at blood pressure. Blood pressure is another one that I often have people take a look at. Now, we can go to your triglycerides and your HDL. I do have training to talk about that. Let's do that really quickly. I'm sorry. So from the lipid panel.
Hold on a second. Let me see where they at.
Mm-hmm.
Oh, lipid panel right here.
Yes. So, and I agree heavily with Nurse Laura when she talks about how in this space we are criticized because we all run high cholesterol, LDL. Yep. As a matter of fact, I am so grateful that you don't have the word bad up here because we also always associate LDL cholesterol with being bad cholesterol. Let's kill that myth tonight. I love the way you said that, Nurse Laura. Like, this is such a myth. It is such a myth. We have named this bad cholesterol. And let me just say, nothing in your body, nothing that your body makes is bad. Let's just say that first of all, right? Your body makes cholesterol, and it makes it. And I heard you say the word. It makes it in order to protect you, right? And the cholesterol that we're eating, which the myth says that the cholesterol we're eating is what clogs arteries and causes heart disease. That is wrong. It is not right. It is incorrect. All of those words that are synonyms of wrong. It is all of those things, right? So cholesterol, the LDL cholesterol is actually your friend. If we were to right now snatch all of the LDL cholesterol out of our bodies, we would all die immediately. That would be an immediate right? Yep. So one of the things that's happening is, and again, I'm not a doctor. I don't give medical advice. Everything that I speak about is educational. You can Google it, or I can send you a research paper for it. Just let me know, right? That's my disclaimer. The LDL cholesterol being lower is really a hindrance to the body, right? I did research myself on LDL cholesterol, and essentially it triggers it actually triggers diabetes, right? The LDL cholesterol. There's research that shows that it will trigger you to become insulin resistant. Also, dementia patients that they're doing research on, one of the things that they see with these patients is that in their death, they realize that their brains lacked LDL cholesterol. So you're hearing it tonight, maybe for the first time, that LDL cholesterol does not need to be lower. What you do want to take a look at is your ratio of HDL and triglycerides. And Robin's are perfect. According to the Society of Metabolic Health, they are perfect. So we are in agreement with that. And so I just want to drive that home, because I meet so many people who are on a statin, so many people who ask me about being carnivore, and they want to know, is my cholesterol going to go up? Yes, and that's good.
Yep.
Yes. They're like, no, I don't want my cholesterol high. Yes, you do.
You do.
You want your cholesterol high, right? And it's going to take years, we believe, maybe 20 to 30 years before the things that we're saying here become more mainstream. But for those of you that are researchers, if you want to look up Ansel Keys, Ancel is his first name, Keys is his last name. If you're diligent like us, you can research him and understand that he is the one who got us in the cholesterol chaos. That's what I call it, cholesterol chaos. And we have been trying to recover for years from his chaos. As a matter of fact, cholesterol is being blamed for what sugar is doing. Sugar is what's going to get stuck in your body. This is the last thing I'm going to say, Robin, before I stop. This is a little just trick to think about. We call cholesterol the things like saturated fat, butter, creamer, all of these things. We call those the saturated fat that makes the cholesterol go up. And that's what's getting stuck in our to cause heart disease. I just want us to use a little common sense. I was an elementary school teacher, so stay with me on this. I was an elementary school teacher. So I often say, if you toss on the ground butter or saturated fat, it's going to slip and slide. I'm not going to ask the question. I'm just going to tell you it's going to slip and slide. If you toss some sugar and water out there on the floor, it's going to be sticky. It's going to stick. That is what causes heart problems. It is the sugar. So last thing, the multiple things that are directly tied to insulin resistance are and actually, Robin, I don't know if you still have it in your show notes, the picture of the little wheel that I do sometimes, the circle.
Let me take a look.
Okay, and if not, I'm going to try to pull it up really quickly. I did not think about that until just now.
No, I don't have it in this one.
Actually, I do have it really quickly. If I can share my screen for 1 second. Thank you. Let me see if I can do this. This just popped in my head. Saying share screen. This is where I want to be. Can you all see my screen?
Not yet. Here it comes.
Yep.
Here we go.
Yep.
Okay. So I think I can. Yes. So this is insulin resistance, guys. So we talked tonight about, typically when you hear insulin resistance, you only hear about prediabetes or diabetes. What I want us to really start considering is all of the things that you see represented here. And that is not only type 2 diabetes, but type 1, type 2, type 3. And type 3 diabetes is actually being labeled now as Alzheimer's and dementia. So when insulin is not working properly in your body because you have overeaten carbohydrates, you're sedentary, then Alzheimer's and dementia. You're talking about a high fasting insulin, high blood glucose, low HDL, high triglycerides, autoimmune issues. Personally, for me, I was diagnosed with lupus. I know now that it was directly tied to what I was eating. And now that I no longer eat that way, guess what? My insulin, my autoimmune is now healed. I don't say reversed. It is now healed. Cancer. I heard you all mention fatty liver earlier, coronary artery disease, high blood pressure. So you're going back and forth to the doctor. You're taking a high blood pressure pill that makes you urinate on an often basis. However, you're still not correcting insulin. Heart disease, Obesity, we are starving because we're eating carbohydrates that are not satiating the body. When your body is not satiated, it is going to continue to want more. Mental disorders, there's so much research right now showing how disorders are directly tied to insulin resistance. Sugar cravings, the more you eat sugar, and remember, carbohydrates are sugar. All plants, anything that's plant-based is going to metabolize in your body as sugar. Okay.
Yep.
Then when you keep going over here and you see PCOS, thyroid, Nurse Laura was asking a lot about the thyroid panel. Robin dealt with eczema. I've dealt with eczema, skin disorders, and acne. All of those things were a part of the way I was showing up as insulin resistance. Neuropathy, the abdominal. That's one of the things that we did not talk about is the waist circumference is also a way. If you have a big belly, I'm just going to say it out loud. You are insulin resistance. That is where that food is being stored in your body. So that visceral fat, abdominal fat, kidney disease, retinopathy, blindness. For men, low T, right? Yep. Women, I keep saying it. Y'all making these men eat these salads and eat your vegetables. Get that man a steak, girl.
Yes. Yeah.
I'm gonna go X-rated, but meat. Let me just say that, okay? I'm gonna come off of that one. But GERD, acid reflux, y'all, just this circle of hearts is what we call it. All of these things are directly tied to insulin. It is not just pre-diabetes or diabetes. As I said when I started, and this is where I'll end. Y'all, it is so true that it's not just about that. It is so much bigger. So, Robin, thank you for letting me share tonight. Nurse Laura, such a pleasure to connect with you and to just see the similarities as we grow as carnivores and learn more about what actually fuels the body. So kudos and major shout outs.
Thank you both. I appreciate y'all so much. We have a few questions in the chat. I'm going to just go to those. So Charlie,
I was just going to say, I saw Charlie's and I was like, that's a good one because that's what I've been taught.
So would a lower reticulocyte count with an elevated A1C 555 to 58 help demonstrate that red blood cells live longer on a carnivore, right? Yeah.
Go, Nurse Laura.
Yeah. So this is something that I kind of, like I had alluded to earlier, I had somebody whose A1C was creeping up, but their fasting insulin was under 3. And I'm like, you are not, there's something doesn't look right. But they were eating kind of like opposite of me. So I do 80% fat, 20% protein. They were doing 80% protein, 20% fat. And I'm like, well, I think that's why, for one reason. But I said also, according to like Barry and Dr. Chafee and Baker and Bickman, I listen to Ben Bickman a lot. He's a good researcher. Is that when you feed your body correctly, that your red blood cells live longer, so you have more of those cells to glycate. So the more of those laying around longer, because again, this test is set up on the average person. Their red blood cells may only live, just maybe half to 3/4 of the amount of time that somebody that is carnivore and is healing, that theirs survive. So I have seen exactly what Charlie was talking about here, where we do see that those cells do live longer, which is good. But when we look at the standardized test, it's like, that's why it's good to have both of those. So you can also kind of see how is the fasting insulin, because the way I explain to like my diabetic patients, and I have a lot in home health, I mean, as young as 29 that are severe diabetics. And I'm always like, if you think of the cell as a ball and you're trying to get the energy inside that cell, that's how the body wants to do the glucose. So you have to have that insulin to be able to unlock that and open that cell up to allow that glucose in. And most of the time, like you alluded to earlier, it's because that overabundance, more than 1 teaspoon of sugar in 24 hours is more than those cells can uptake. And so then you always have this insulin bombarding the outside of that cell, and it just makes it to where nothing, wants to get in there because it's resistant. So that's kind of how I explained it to my diabetics, because a lot of them are men and they're very visual. So I just have to explain it to them that way.
Yeah. Thank you so much, Laura. I did drop the definition of a reticulocyte count into the thing, because I'm like, what is a reticulocyte? So that is in the chat, in the comments there for you guys. Thank you, Charlie, for the question. We do have a question from Country Girl. Hey, girl. So glad that you're here. If I have insulin resistance and pre-diabetic, how long could it take to reverse?
Depends.
Yeah. So if you are pre-diabetic, you are insulin resistant. So your manifestation of insulin resistance is prediabetes. So let me say that again. So the insulin resistance is there. Prediabetes is just one of your manifestations. And so there's not a timeline, because it depends on how insulin resistant are you, right? What are your numbers say? Do you have other, what I call manifestations? So the circle of the hearts that I went around, do you have some of those other things, right? So the goal is to, as we talked about earlier, is to recognize what your fasting insulin is and your A1C, right? Those are the things that you want to watch for in terms of your lab work. So there is no, so for me, I've been walking this walk probably for about 3 years, and I still am running about a 5.6, which can technically be just outside of being pre-diabetic, but yet still can look like it's in the insulin resistance range. What helps us, as Nurse Laura is saying, is that the fasting insulin is running low. So that's what, so it's going to take a lab work, Country Girl, to kind of really unpack that. But the goal then is to continue to, what we know is restricting carbohydrates is the way to go to start to turn it around. But everybody's level, your entry level is different. So like when I'm working with my clients, some of them, have been diagnosed with Hashimoto's. Some of them have fatty liver. And so it just depends on where you are. What we know, the beautiful thing is, the beauty is that what we know is restricting carbohydrate helps fix all of that. Going carnivore turns all of that around. Like when you go back for your labs, like so many things improve. For me, it was like, oh my God, my skin is better. Is this carnivore? Right? My don't hurt anymore. Wow, is that carnivore too? Right? Because what's happening is, and I was sharing this with my dad earlier today, is that when we eat these carbohydrates, they wind up anywhere in your body as inflammation. Whether it's hitting the eyes, whether it's in your knees, it's like a plant sprouting. It just goes anywhere. I say seeds never die, right? So now they're sprouting out in your body in different places. And so now you have to figure out, how are you going to start to dial that back? So I see your Country Girl, I see you are 5.8, which is pre-diabetes according to all of the norms, which is, yes, insulin resistance. We would need to couple a fasting insulin with that to really get a better picture. So again, that's a test. If you're not doing that, you want to start to ask your doctor for a fact. Most doctors are not going to do that, and they get confused. Let me just say that. If you tell them you're fasting insulin, they think they're doing it because they did a glucose. So you have to be very specific and say, I want to fast an insulin. They ask you why. This is where my role up here says advocator. You have to advocate for yourself, self-advocate, and tell them, hey, you on my payroll. My insurance company paying you for me to be here, and everything that they don't pay, I'm going to pay. So, hey, this is what I'm asking for.
Yeah, that's what I had to do for my fasting insulin. This is not a typical test that goes with your lab panel. So I sent a note to my doctor's office and said, I want to include a fasting insulin. And the nurse told me back, like, that's not typical. You're going to have to pay for that out of pocket. She didn't want to do it. And so I told the doctor, I want a fasting insulin. And so she added it on. So, and I've been seeing the same doctor for many, many years. I don't know, 30 years or something. So she maybe longer than that, 40 years. So yeah, it's been a long time. So she, she just went ahead and ordered it. But yeah, you have to advocate. You have to be willing to push back. If they tell you no, you got to push back. And if they're still telling you no, then it might be time for you to consider looking for a different doctor.
Oh yeah, we
Or go to own your own labs.
Yeah, go to own your own labs.
Yeah.
You can definitely do that and pay that out of pocket.
One thing
So
I
let
did
me,
not say, Robin, and I did see a good question in there. One thing that I did not say is with the high cholesterol, you want to couple that with a CAC scan, which is a coronary artery calcium scan, because that's going to give you a direct picture of your heart. So when a doctor tells you you have high cholesterol and they want to put you on a statin, which my doctor, Dr. Moore, often says that is a risk factor, right? Depending on what all you're eating, you want to ask for a CAC scan, and it's not covered by insurance, but it is worth every penny that you spend.
All right. We have this question from Oak Town Girl. If the test simply says insulin and the preparation is to fast for 12 hours, is that a fasting insulin test?
I would say yes.
Yes.
I would think so too.
Yeah.
And then
I would say so.
I have also another question. Where did it go? Here we go. Sharon's here. I didn't have a big belly until after menopause. Where does the inflammation in the body come from and how do you get rid of it? Carbohydrate. I'm going to just say carbohydrates, too many carbs. How you get rid of it, reduce your carbs.
So let's break it down a little bit more, Robin. So carbohydrates are sugar, anything that's plant-based, the ultra-processed foods that we are eating, that you have 50 million ingredients on the back of it that you cannot read, seed oils, all of these things are foreign to the body. And so because they are foreign to the body, then they inflame the body. It is almost like your body is in a fight. And your body is losing, and this is why you're swelling up. So when you punch somebody in the eye multiple times, you get this swelling. It's essentially what's happening to your body. And how you get rid of it, stop eating carbohydrates.
Yes.
Yeah, because it causes oxidation. I work, that's sometimes how I explain to people is like, if you have a car that's set out in your yard for 6 years, and where I live, there are people who that happens with. And I'm like, you see how the paint has oxidized? That's what is happening inside your body when you're putting this stuff in there. Your body is just being poisoned. So, and funny thing about the CAC scan, I definitely love and have told people to get that. I don't think that one's available on Own Your Own Labs yet, but I think that they're working on that. But it is a very cheap scan to have done. And I think having that done yearly, I think that's a good idea. Some of the other labs, I think every, 4 to 6 months, but myself, I think doing the CAC score, because my CAC score actually went from a 378 after being keto for 26 years to 2.5 years into carnivore, went down to 0, which they say can't happen, but mine did. Yep. And I've had many people who their CAC scores have went down. So it can happen. It's just that they don't see that because most people don't change their lifestyle in order to get that. The other thing I want to say about cholesterol, and I'm not sure if you've seen this, with the clients you work with, but being a nurse anywhere from ICU, ER, nursing home setting, home health setting, I have seen a lot of centennials, people who made it to be 100. Every single one of them has high cholesterol and high LDL. So during COVID, those were the people that had the higher LDL and higher cholesterol did the best. Those were the ones that we saw come off of the ventilators. And I don't care. They could, I mean, we had some that had diabetes, some kidney disease, but if it seemed like that cholesterol was high and that LDL was high, which helps the vitamin D and the immune system, they did much better than the 29, 40 that didn't have any of these other diseases, and they were on a statin. And I'm always like, and they're always like, you don't believe in statins? And I said, this is what I'll tell you about statins. I wouldn't give them to my ex-husband. So I think that's,
Right.
yeah,
Don't take one.
And that's the point, is like, get off of them. Like, you didn't hear it from me,
Yeah.
but get off of them. Just stop
Right.
them. They are doing, this is where you advocate for yourself. Do your research
Yes.
about what they are. It's all about the money. They are not saving lives, period. It's not stopping heart disease. We've been low fat all this time, and folks getting sicker and bigger. So
Yeah.
they obviously ain't working.
Yep.
So what is a normal fasting insulin? I've not had one yet. My A1C is 4.8.
Excellent.
That's an excellent A1C. So a normal one for when you're looking for insulin resistance, you want your fasting insulin to be under a 6. The fasting insulin needs to be under a 6. And again, you all can go to the Society of Metabolic Health. I think, Robin, you put it in the chat. That is,
I did.
I use those numbers coupled with Common Labs from Common Sense Labs from Dr. Berry.
Yeah.
All right. I'm trying to see. Did I have another question? I think that was all of the questions.
Well, I want to ask Nurse Laura a question.
Okay.
All right. So my question is, because you mentioned it earlier, and I just want to kind of wrap my mind around it, because in the Black community, one of the things that we often hear is that, all Black people are vitamin D deficient, right? But what I'm starting to see is most of my vitamin D deficient clients are also my statin clients. So I'm starting to see a trend of this. So I just kind of, if you can, for me, this is, personally for me, because my vitamin D has improved. My cholesterol is very high. I've had it checked. My CAC is a 0. But I do like that you said get that every year. I'm going to do that again, because it's been about 3 years. Because they told me you don't have to get it again for 10 years. But I think I've read somewhere where you need to do it more often. So thank you for confirming that. But I would just love to hear your thoughts around cholesterol and vitamin D.
Yeah. So yes, I do think there is something with people who have more melanin in the skin. It is shown that decreases how effectively somebody converts vitamin D. But I have also seen where the higher the cholesterol, the LDL, the better the vitamin D level goes, even with the same amount of sun exposure. Does that make sense? So even though they don't change, maybe going outside. But I also do recommend, and I tell everybody, I'm always like, I'm not a doctor, I'm a nurse, but this is what I take. I always recommend the K2D3 to help with that. And then like the one that I take has coconut oil in the gel cap, the oil cap itself. So because there's a lot of times I'm fasting, and I just did a dry fast yesterday, and I'm like, how am I supposed to take that K2D3 when I'm not eating anything? Well, that's why I got the one that comes in the coconut oil, like MCT oil. But I always recommend people do that as well, because not only is that good for your vitamin D, but I think that is truly what helped move that calcium out of my coronary arteries and put it over into my bones, because I was osteoporotic at 34. I'm 54, and I'm so far the other direction on my osteoporosis numbers that they're like, don't come back. Like, if you fall down and break something, come back. And it took a year and a half of doing that, but it did make a big difference. My teeth improved. Everything bone wise has improved. I've lost no height in 20 years. And for a female who went through menopause, that's, substantial. So, but yes, I think that having more cholesterol, as I said, these people didn't make it to 100 because they were, being poisoned. And that's what I always tell patients too. I have a lot of Christian patients that I go in the homes. And I'm always like, God put the liver in your body, and it can produce up to 85% of the cholesterol every day that's free floating in your body. Did he do that on accident? Was he trying to kill you slowly? And they're like, well, no. And I said, then why would you take a pill that not only blocks what you eat, but blocks what your liver produces? And it also crosses the blood-brain barrier, and it blocks the brain because it makes its own. And it blocks that, which is, I did a thesis in, I don't even remember if it was 2001, 2, and I showed correlation and causation, which took 3 years to get published because they were like, they're going to kill you. And they did really say that to me. But it showed that, like, in 1987, Lipitor was the first one to brought on market. And then, of course, our lovely Congress was like, oh, and now we're going to let you do commercials on TV for medicine. Thank you. And then what we saw was by 1991, 92, a 40% sharp incline of all things caused that are kind of like demyelination. So Alzheimer's, dementia, MS, Parkinson's, ALS, all of those numbers went sky high. And so I had all that. I mean, I did research like no, and this is before the internet was out, so it was the old school. And I remember, I got 100 and some percent on it. And they were like, supposed to go into the medical journal with University of Iowa. But she goes, I'm not going to do that because this is what can happen. And I was just like, at the time, I was like, what do you mean? Like, that's crazy. You should be able to put it out there. I got over 100%. I was so proud of the work I put into it because I was seeing such a high number of people getting these diseases that I'm like, I've always been somebody who wanted to go hang out at the older person's homes instead of playing at the park with the kids. Cause I'm like, I ain't learning nothing from those kids. They're the same age as me. We all know the same thing. I need to know what these people who have been around know, and I want to get their information. And so I was always around that generation. And then all of a sudden it was like crazy high numbers of these diseases, including joint disease, to where they're all being replaced. Degenerative disc disease. And I'm like, you ain't got no fat in there. You got to keep, the disc happy, and you got to keep the meniscus and the eyes happy and the things like that. And so sorry if I went off on that.
No, I want to say that DeNitra recently discovered beef fat.
Yes. Woo, I love it. It is the best.
Yes. So I
I
love hearing you talk about this because, and like you said, people with more melanin. And so even like being told to stay out of the sun, like the sun is not your friend. No, your body is consuming carbohydrates. That's what I figured out. Like, right? It is the stuff that's inside it. Thank you for sharing that. And yes, I am now a beef fat. It's literally all I want in my life. Like I told Robin on a text message today, it's my new popcorn. Like I can put it in the bag and just keep going for it with no problem. So, oh my God, it's my new love. As a matter of fact, we're gonna have some
love it
when we finish. So, thank you, Laura.
Me too. Yep.
One more question. We're going to go ahead and answer Charlie's question, and then we're going to go ahead and wrap up. So thank you, everybody. Do most doctors understand the nuance of large, fluffy LDL versus small, dense?
Nope.
All of our heads are just shaking no.
Nope.
Not yet, but hopefully eventually they will as we get along down this road.
Yeah.
And
hopefully
no statins.
Yes. Yeah. But I think also, hopefully you are with doctors that are willing to learn, because it's just like nursing or any other degree that you have. You only learn a snippet of it in that college, in the books, in the clinicals. You have to get out there and be on the floor, be with the people, listen to them, listen to their families, watch for, when you see this in several people, it's like, okay, there's a trend there. And you have to be willing, and your doctor has to be willing to learn from that, because what they're being instructed, as we know, in the medical schools is exactly what the medicine people want them to learn and to know. And that's what they're taught. And that's what their whole computer systems are set up on, protocols that they didn't make, that they go by. And that's why I always tell my doctor, don't even bring that computer in the room, because the janitor could come in here and type in exactly what I'm telling them my symptoms are and come up with a diagnosis. because the computer is telling you what it is. You're not using your brain. And she doesn't even bring the computer in. I don't even have to ask her anymore. But it's like, hopefully in time, your doctor, and if not, you sometimes have to find a different physician. And I tell people, it's not that I want my doctor to be like, every time I say that this is a certain way, that he's like, yep, it's the way it is. I want them to actually understand and care enough to look into it. And I go to every doctor's appointment with studies in hand. I did the one with Ansel Keys. I've done the Jupiter study. I mean, I've done a ton of these where I'm like, I've got receipts, and they love to read that kind of stuff. You telling them, sometimes they kind of close off to that, but they love those numbers. They love to see the graphs. They love to see all of that. So it's just like you say, being an advocate. I did a talk just a few weeks ago on advocacy, and I got very, very, very worked up in it because it's something that's lacking, and it's lacking in the medical field. And people aren't taught to be their own advocate, but we
Right.
did used to be taught in the medical field, especially in nursing. That's what I kept saying, was the nurses in the back, listen, like, this is, you are supposed to be that last line of defense with your patients and be an advocate. So I tell all of my patients in home health, and every job I've ever had, whether it was open heart, whether it was cardiac cath lab, is that you have to advocate for yourself, because the doctor doesn't have any skin in the game. It's your life. You have the skin in the game.
Awesome. Thank you, ladies, so much for being here with me tonight. I appreciate it. I've been informed, and it's just so wonderful to have friends that I can reach out to and say, "Hey, here's what's going on," and have you guys help walk me through. So, thank you for being here to do that tonight. If you could just let everybody know where they can find you. I'm going to start with Laura.
Yep. So on here, I'm at Healthy Carnivore. And in my description on there, I have all my other social sites on there. And then I do have a website that is russellbrands with a Z.com, that I do have my natural products, elderberry tinctures, tallow based lotions, all of those things that are natural, because not only what we put in our bodies, but what we put on our bodies is very important. So that is mine.
Awesome. Thank you, Laura. Okay, DeNitra,
Yeah.
let the people know where they can find you.
Absolutely. On Instagram, I am at advocator, coach, and educator. And essentially, at some point in life, I'm going to be known as the ACE. That's what that stands for, is ACE. But my name is DeNitra Davis. If you're looking for me on Facebook, you can find me as DeNitra Davis. The company that my husband and I have together is called Nutritional Knowledge. You can go to nutritionalknowledge.com, and we spell nutritional, KNEW. Nutritional knowledge, because we believe if you knew better, what you could, you should, you do
You
better.
do better.
Yes. So thank you, Robin, for putting yourself out there. This is really good for those that are considering carnivores, to know that no, eating all this meat is not going to kill you. It's actually going to give you life.
That's
So,
right.
thank you.
So I just want to say thank you to both of my guests today for, talking us through this and sharing this information so boldly. So if you found value in this conversation today, we're going to ask that you share this video out with somebody that you know needs to try carnivore. If you're concerned about trying carnivore, I've been doing great for 2 years. And I think about Laura and what she was saying about keto for 26 years and finding out after 2 years on carnivore that her CAC score had gone down to a 0. This is a long game, right? This is a marathon. It's not a sprint. And so we want to make sure that you're aware of that. Make sure that you're subscribed to the channel. Come and find us on Hey Sister Girl, which is our show, which is on Monday night, every Monday night at 7:00 Eastern Standard Time. And then Laura has a show also that she does on Monday nights as well. So you can catch her over on her Healthy Carnivore channel as well. And so we're going to see you next time for CarnivorousGrama Speaks. Thanks for being here, everybody. Have a good night. Bye.
Thank you.
Bye, everybody.